Hello, everyone. Welcome back to It's Giving Health, a podcast by Advanced Community Health dedicated to educating our community on a wide variety of topics. I am your host, Donnae Ward. In today's episode, we're tackling a topic that's near and dear to my heart and impacts millions of people across our communities: diabetes. Here's the thing: diabetes management isn't just about tracking numbers or following a list of do's and don'ts. It's about taking control of your health, understanding your body, and building healthy habits. Today, we're going to clear up some of the myths and misconceptions about diabetes, talk through the challenges many people face, and share tools to help you or your loved ones take charge of your health. Joining me today is Ziad El Tannir, a physician assistant at Advanced Community Health who has dedicated his career to supporting patients in managing conditions like diabetes and empowering them to take charge of their health. So let's dive in and have an open and honest conversation about living with diabetes and the practical ways that we can care for ourselves and our loved ones. Welcome, Ziad. We're so glad to have you here.
Thank you.
So let's start by, telling us your background, a little bit about your role as a physician assistant at Advanced Community Health, and kind of what drew you to working with diabetes management and primary care.
Yeah, so my name is Ziad. I am a physician assistant. I've been in practice and at Advanced Community Health for 5 years now. I do primary care, so I see patients all the way from 5 years and up until my oldest patient is 96 years old. I was drawn to primary care and to working at federally qualified health centers. Even before I applied to PA school, I worked at a free clinic in my hometown of Matthews, North Carolina. So I was drawn to the population that really needs care the most. So while I was in school, I researched clinics that kind of fit the mold of where I want to practice and what I want to do. And I was lucky when I got out of school. I knew I wanted to move to the Triangle, and Advanced Community Health was a good fit on all fronts. And I've been there for 5 years now.
Yes, I'm so glad to have you.
Yeah.
Okay. So when most people hear diabetes, they think high blood sugar. It's like the first thing that comes to mind. But diabetes affects so much more than just your glucose levels. Can you help us understand what diabetes really means for the body and how it just impacts daily life?
So it's a really good question. Diabetes really affects your whole body. So when I'm explaining it to patients, I like to start at the top of the body and then kind of work my way down. So the biggest effects when your blood sugar is really high, it really affects your eyes and causes retinopathy, which can really affect your vision over time. Moving downwards, it affects your heart, it affects your kidneys. So diabetic nephropathy, which is effects of high sugar on your kidneys, are one of the most documented effects. So we really worry about the kidneys with diabetes. And then moving on downwards more, people have polyneuropathies, which means that their fingertips and their hands and their toes essentially go numb. So they stop feeling their feet very well, which can be very dangerous because if they step on something, then they don't feel that there's a wound there, and that can get infected. And part of why things can get infected is because your blood vessels aren't as open as they would be in a normal person, because diabetes kind of magnifies those effects of atherosclerosis or plaque buildup. And it does that around the heart, and it does that in your blood vessels all around your body, but especially distally, meaning far away from your heart. And that is in both of your legs. So that's why you might see people with uncontrolled diabetes for so long lose their limbs, or especially their feet or legs over time, because it's a combination of not being able to feel their feet. So an infection happens, it's not treated well, and then your body can't treat that infection well because the blood supply down there is not very well. So a lot of different processes happening, but obviously on the surface, like you mentioned, it's my sugar is high, and how can I get my sugar down? But sometimes what people fail to understand is that sugar being high is not just affecting one thing. It's really a full body process that if we don't get control of, it's going to have negative effects on multiple systems in your body over time.
Thank you. So there's also often a confusion when we talk about diabetes, because we know that there are different types. We have type 1, there's type 2, gestational diabetes, even juvenile diabetes, right? So can you kind of break down what patients need to know about each one?
Sure. So type 1 diabetes is genetic. People usually can't do anything about that. Patients are usually diagnosed early in life, around age 11 or 12. And type 1 diabetes is caused by the destruction of beta cells in the pancreas. Your pancreas is your organ. It's a small organ that sits kind of right in the middle of your stomach, under your sternum. And that's the organ that produces insulin in your body. So people who have type 1, it's an autoimmune process, meaning your body destroys a part of your pancreas where the beta cells are formed. And your body just stops making insulin. And without insulin, you can't your body can't regulate sugar. So usually those kids show up and they're pretty sick because all of a sudden their sugar spikes up really high, and they might even go into something called diabetic ketoacidosis, where your sugar gets so high that it causes nausea and multi-system failure that you have to go to the hospital and get treated acutely. So with type 1 diabetes, there's one treatment, which is insulin. Your body's not making any of it, so we got to give you insulin. So usually those kids get put on insulin pumps really early, and then get educated on how to treat diabetes. Type 2 diabetes is a very different process. Type 2 diabetes is mostly due to your body just being overloaded with sugar all the time. So either your pancreas can't produce enough insulin to keep up with the demand. And then part of the problem is as well, when you're eating so much sugar over time and your pancreas is producing so much insulin, then your body's response to the insulin also goes down. So it's not responding to the insulin. So it's two processes there that are happening. So type 2 diabetes is for the most part due to the patient and due to the diet and the exercise. Genetics does play a factor. So if your parents have diabetes, you're way more likely to get diabetes. But for the most part, it is up to the patient and their lifestyle and everything. Over the last 10 years, we have been seeing other types of diabetes, like autoimmune diabetes, or sometimes endocrinologists will call it type 1.5 diabetes, where people present like type 2, but at some point they stop responding to medications and they only respond to insulin. So there could be a small overlap in a very small population, but usually it's either type 1 or type 2. You asked about gestational diabetes. That's usually for women while they're pregnant. So while they're pregnant, they do a glucose intolerance test to see how their body's responding to sugar. And for some women, their bodies don't respond very well to sugar because their body's already under so much stress from the pregnancy. And then they have to be put on insulin while they're pregnant.
Okay, thank you.
Yeah.
So diabetes management, which I believe is about the whole person, right? It's just not one thing, and not just glucose readings. And of course, in my work with diabetes management, we do have more of a holistic approach. What does your approach look like one-on-one with patients?
So my approach really involves, it's similar to holistic. So I don't want the patients to, my first thing when I prescribe medications is I don't want the patients to think, here's your medicine, this is going to solve the problem. And then they're going to go home and say, well, I have a problem that the provider I saw gave me a solution, so I can keep doing what I'm doing.
Exactly.
And in that situation, that does work for a few months, maybe a year. But then we see that the sugar comes back up, and then we have to add another medication. And then we have to add insulin. And then they're getting sicker. So really, it's all about a combined team approach, a holistic approach. So we're lucky at Advanced that we have behavioral health therapists. So I try to tap into that, obviously, if the patient is willing, to address the issues that are ongoing with food and how our relationship with food.
Yep.
We also have an awesome nutrition team. So I refer to nutrition to teach them about food and how much protein they need to eat and how much carbohydrates and where do carbohydrates hide and how to read a nutrition label, because these are not things that we're taught that most people know about.
Right.
So it's really about getting the whole team involved and about using the tools that we have. So I really like continuous glucose monitors. These are devices that usually go up in your arm and check your sugar 24/7. Some of them last for 10 days. Some of them last for 14 or 15 days.
Okay.
It's really hard for people to check their sugar with their finger, especially when they have to do it 3-4 times a day. So they just stop doing it. So I've made a big push in the last couple of years to try to get people on these continuous glucose monitors so they can check in real time what the food they're eating is doing to their body, because all our bodies are different. You and I might eat the same things, and for you, your body just doesn't respond very well to that particular carbohydrate, and mine does okay. So using a continuous glucose monitor and a diary or a notebook where you record all your food really goes hand in hand to let you know what the food and what the drinks, like what you're putting in your body, what is that doing to your sugar. And it doesn't just stop with food. It's like, how is your sugar in the morning when you had 5 hours of sleep versus 8 hours of sleep? How is it when you went on a 30-minute walk after dinner versus eating and then sitting right down? How was it when you ate dinner at 6:30 versus 11:30? So all these things factor into your glucose control. Stress factors into it. So really just looking at the whole picture and not just saying, well, your A1C is 8. This is what we need to do. Obviously, that's the framework. We still have to follow it. We still have to prescribe medications. But if we don't address the person that's sitting with us and try to address some of these other issues, that same person is going to be back in 6 months or a year. And we're going to have to add another medication. That's been kind of what I've seen in the clinic. And I've tried to, as much as possible, address these other things to improve the outcomes.
And thank you for pointing that out, that we do have to, like you say, address the whole person. So with diabetes, and I know this, that a lot of people just carry a lot of shame and feel blamed for their condition. So what do you want people to understand about diabetes as a health condition rather than, oh, this is a personal failure?
That's a really good question. It's a loaded question. I've had patients tell me before, like I have this one patient who has 3 sisters, and she said when they go out to eat dinner together, they all kind of go to the bathroom before and inject insulin, and she knows that they do, but they come back to the table and like they don't talk about it. They don't discuss anything relating to diabetes. They don't want the other ones to know, but they also know that they just don't want to talk about it. It's difficult because, like I mentioned earlier, with the differences between type 1 and type 2 diabetes, with the definitions and how we tell the patients, it's usually like, well, this is for the most part something that happened to you because of your diet and exercise and somewhat genetics over the years. So people do feel a little bit of shame, but it's about the healthcare team really addressing the needs of the patient and then letting him know that we got to this point. So what happened before that doesn't really matter anymore, but what we do now will affect your health from now until the last day of your life. So there's 2 ways to deal with it. You can, deny that it's happening. You can not tell people about it. You can have some shame about it, or we can really just work together and all be part of a team to try to get rid of this, because it is possible. I think that's something that people don't realize is when you first get diagnosed with diabetes, sometimes it is a lifelong diagnosis and people can't do anything about it. But there are times where people can beat diabetes, where their A1C goes back down to normal. I've seen it a lot of times in the clinic. Unfortunately, it's not in the majority of patients, but it does happen and can happen. So what your attitude towards diabetes as a patient really affects where you go from there. Because if you're going to hide it from the people you love, you're not going to take your medications right, you're going to kind of deny what's happening, it's not going to lead to a good outcome.
Right.
So you really just have to own it. Yes, part of why you're diabetic is your fault, you know, but at this point it is what it is. We all make mistakes, and sometimes mistakes have consequences. So just shifting the framework on, you know, we got here. So what's the best thing we can do now to try to beat this disease and treat this as an illness, because it is. Your body's having trouble processing sugar. You have a sugar disease. So what do we need to do to fight that? And it starts with diet. It starts with exercise. It starts with telling the people around you what is happening so they can help you.
So you can have support.
Telling your partner, your family, your parents, your kids, so they're not tempting you with certain things. Telling them so they can encourage you to move more. It can really be a whole family.
Because it doesn't just affect the patient, it affects their family as well.
Absolutely.
Yeah.
Yeah.
You mentioned something, you just mentioned that I was always taught that once you have that diagnosis, like that is it for the rest of your life. But you're saying now that it is a way that in a way it could be reversed, or you can definitely lower your A1C to before you have that diabetes diagnosis.
Yeah, so once you're diabetic, there are a few things that we'll have to check on for the rest of your life, like getting an ophthalmologist or an optometrist to do your eye screenings every year, checking your cholesterol every year, checking your kidney functions every year.
Right.
So there are things that will follow you from it. But the negative effects of diabetes, once your diabetes is controlled or even back down to normal, we can say that you're not like a diabetic anymore. So we diagnose diabetes by a test called A1C or hemoglobin A1C. Once that magic number gets to 6.5, we diagnose someone with diabetes. There's a pre-diabetic range from 5.7 to 6.4. So anything below 5.7, like 5.6 or lower, is normal.
Right.
So let's say your A1C gets up to 7 and you're now a diabetic. But you go the next day and you start a weight loss regimen, you eat clean, everything is going right in your life, the stress is down, you're doing everything right, and you come back 6 months later and that A1C came down to 5.5. It does happen.
Yeah.
At that point, you know, your diabetes is back down to normal, and there's no negative effects of what happened 6 months ago ongoing anymore. Most of the damage to the body happens when A1C is at 8 or higher. So when the diabetes starts to become uncontrolled. So if you become a diabetic and you find solutions, whether through medicine or non-medicine, to get that A1C down. But if you're able to get that A1C down to a normal level and you're not using medications anymore, that diagnosis can go away. It is something that you can take away. Just like high blood pressure. If you get diagnosed with high blood pressure, and then it is reversible as well. Same with high cholesterol. A lot of these things are reversible, but they're not easily reversible. And that's why people think that it's just there for life and it's never going to go away. Unfortunately, that's the case for most people.
For most patients.
But it is possible. Yeah.
And thank you for pointing that out. So let's, because we talked about just like lifestyle, right? Being some of the things that people, the situation of type 2 diabetes because of lifestyle or genetics. But let's talk a little bit about culture, because I do believe that, you know, environment also plays a lot into when we talk about people being diagnosed with type 2 diabetes. So diabetes population in Raleigh is 8%. And the U.S. is 10%, but Southeast Raleigh, just along those 6 census tracts, so including 27610, is 21%, which, you know, when I first saw that, which is alarming. And we talk a lot about, you know, the work that we do in the health disparities within Southeast Raleigh. So how do those social determinants of health impact diabetes management? How do cultural perspectives impact diabetes management? And just like, shape the way different communities kind of view or approach this disease?
Very good question. Also loaded.
Loaded question.
So the biggest thing that I've noticed is it's been proven that weight is directly correlated with high blood pressure, high cholesterol, and diabetes, specifically diabetes. So highly correlated, meaning like the higher weight you have, the more abnormal or the more overweight or obese you are, the higher your chances are of getting high blood pressure, cholesterol, and diabetes. So sometimes I think in certain communities, especially in the Black and brown communities, and I can see that working at a federally qualified health center at Advance like we do. The perception about weight and some of those cultures is a little bit different. Like what is normal and what looks good are a little bit different. Like I can tell from my own experience, I got healthier after college. Like I started eating better, exercising. I wasn't in college anymore.
Right.
And then I would go home and my mom would just like say, "You're like unhealthy.
Right.
Why are you not eating?" Even though I was unhealthy before, now I'm healthy.
Yeah.
And I hear that over and over from my patients. Their body mass index, which is a calculation based on their height and weight, is telling me that they are obese. But these patients are saying, no, this is my ideal weight. Like, this is where I want to be. This is where I look good. So this is where there's a disconnect between what us providers want to tell the patients. And I'm going to say, no, your body mass index is like 35. Normal is 25 or lower. You need to lose this much weight to get back into a normal weight before you develop something like diabetes. And this is where patients are saying, you know, no, like my cultural norms tell me that this is where I look good.
Culture plays a big role. Yes.
And I am all for body positivity. You know, no one needs to tell people how they look or what to do. But from a medical perspective, things are different. We do see there's, like I mentioned, a clear correlation between weight and diabetes. So while it is good and healthy to be positive about how you look and who you are, it is also important to acknowledge that if you are overweight or obese, you're putting yourself at a much higher risk for diabetes and other diseases. So this is where it gets difficult, in telling patients that they do need to lose weight when they don't think they do. Yeah.
And I think that it's like you talked about, a team approach, right? So they hear one thing from their doctor, but just kind of like knowing that maybe there are some changes that they need to make. And there's a balance between like, how do we still get you to look and feel good in your body, but then also know, like you say, you're at risk. And that comes from having those conversations of understanding other cultures as well, you know, so that if they're talking to people that kind of understand their culture and where they're from, or, you know, or even from the same culture, then they could receive it more as, okay, you're at risk. And how do we find that balance? So yes,
exactly. Yeah, it's not easy, like shifting perception of what people think looks good or what people think are healthy. It's a little bit difficult, but just part of what I try to tell the patient is what like looks good and what healthy is can be different things. Like you can look good and still be a little bit overweight and still be putting yourself at a higher risk. So it's more about getting healthier. It's not about just focusing on like how things look.
It's funny that you mentioned your mother. The same thing when I started to lose some weight and I went back home to the Bahamas, everybody was like, you disappeared. What's wrong with you?
Yes.
So I get it. So you mentioned this too, of being a part of a team. Diabetes management often involves multiple healthcare professionals. Can you just walk us through the role of the primary care providers, the diabetes educators and specialists? How do we work together to support patients? Why is that important?
So providers know that they are kind of at this central part of the team, but they know that they are a part of the team. Especially working at federally qualified health centers, we see a lot of patients. The need is there. We know we can't do it alone. So we try to use everything at our disposal as providers. Some clinics are more equipped than others. Advance is in a really healthy position to where we have these resources that we can rely on. We have nurses that can do diabetes education. We have behavioral health therapists that can talk to the patient about their weight and other behavioral health concerns. We have nutritionists that can talk to them about their food and exercise and portion control. So the provider really kind of plays that central role. And then really it's up to the provider to decide who do they need to engage for this patient's care. And we want to try to engage as many of those other people as possible. Obviously, the patient has to agree and has to spend the time and be able to spend the resources to come to all these different visits and engage. But we see that the more the patient is engaged, the more they tap into these other resources, the better the outcomes are.
Okay.
But it's up to the provider also to realize that, the patient comes in, we diagnose them, we treat them. It doesn't end there. It's up to the provider to engage these other people at their organization, the nurse, the health educator, the nutritionist, the behavioral health therapist. The provider has to put in those referrals, has to engage the team to contact the patient. So it's up to the provider to make sure that that patient has access to all these resources that they need.
And I think that even just we talk about the provider, the nurses, the registered dietitians, but even just more of a community approach to taking it even further. So the programs that we offer, right? It's my plug. The programs that we offer for diabetes management. So I'm pretty sure you heard that we do have a diabetes management program. So it's called DiaBeat It. Yes. And I think that we, talking about working as a team, why it's so important to have programs like this. So this program is, we actually just launched our second cohort last night. It's a diabetes management program that has an holistic approach, but working as a team, I'm bringing in providers, to come in and talk about different things. I'm bringing in the pharmacists to talk about medication management, the behavioral health therapists to talk about mental health and diabetes. So really the goal was to design a culturally relevant program for people to tackle type 2 diabetes, whether you're newly diagnosed or you've had it for years. Because once again, just talking about the whole person, it isn't just one thing, right? It isn't just about what is a carb and counting carbohydrates, but it is about your stress level. I'm excited that because you mentioned talking about eye health and kidney health and even feet, when we talk about that, so we're going to have something like a spa day when we talk about massages, and we're going to, so just incorporating the curriculum to be that this is what you need to know about diabetes management, but how could we make it personable? How can we make it culturally relevant? Talking about eating foods from your culture. How do you cook more foods that you enjoy? Because I think that that's actually a healthy way of eating is when you do eat from your culture, but like, how do you make the food healthier for you and your family? So that is like the purpose of the program. But like I say, I cannot do it without the providers.
Sure.
And, because it's a whole team approach. And we also talked about, what did we mention? Family support. How do we get our families involved, right? Because that's important. It does not just affect the patient. So yeah, that's
and what's good about a program like that is, as we talked about earlier, is that it takes the stigma of a diagnosis like that away, because it brings people who don't know each other into a program, and they can see other people in their community that are dealing with the same disease, and it really takes the stigma away from having that diagnosis and connects people with other members of their community. So it's really a great program, and I hope it continues, and our patients are really benefiting from that.
And like you mentioned, even the group last night, everybody's so different ages, different backgrounds. This person is like, I feel better about the way I've been moving my body, but I could really use help on what are some healthy meals that I can make, or somebody who's like, I just want to know how to manage my stress better. I know my stress is making me more sick. So everybody is at a different, but they're all able to share, their experiences. So.
And then you and I are also involved in the Nourish RX program, which so far has enrolled 200 patients, and we're hoping to enroll up to 600 more.
I know.
And it's a program that gives people a box of healthy food every 2 weeks for a whole year. Diabetic patients at Advanced Community Health.
That's amazing.
So over the next year, we should have about 700 patients who are receiving a big box of healthy, fresh food every 2 weeks. So it's been a great partnership with the Nourish RX team who got a grant from Wake County. So that's where the community approach to solve the problem is helpful, because getting patients the right foods at their home is really central. And then helping people understand that fresh foods, good food, cooking at home, all these things really matter.
They really do. They really do.
And
it's just little things.
And in Southeast Raleigh, where our main clinic is, there's not great access to healthy, fresh food. And that really affects our patients. You talked about the statistics earlier with Southeast Raleigh having 21% rate of diabetes. That plays right into it, because if your grocery store is a Dollar General, you're not going to find healthy food there.
Exactly. Okay. Yeah. So a lot of good things happening. A lot of good things.
Yeah.
Yes. So we talked about this a little bit about family involvement, but how can families better support their patients? Just how do we maintain healthy habits for everyone?
So it's really about like engaging your whole family. And
Hmm.
what I mean by that, if you have a partner, for example, that's diabetic, like don't bring groceries and foods into the house that your
Hmm.
partner shouldn't be eating. Try
Hmm.
to support them in
Try to
that.
support them.
Obviously, you can still eat those things if you don't have diabetes in moderation. But
Right.
if you know that your partner or your son, your brother, someone else in your family member is trying really hard to eat healthy and stay away from certain things, then be cognizant of that. Don't tempt them. Don't ask them to go out
Mhm.
every day. Try to cook healthy for you and for them.
Right.
So really engage them. And similar to what we talked about,
Hmm.
those patients that have diabetes do feel a little bit of shame.
Right.
So try to take that away by engaging the whole family and making it not just about the patient. Like we're not just doing this for you because you have diabetes, but
Hmm.
we're doing this as a family because we all
Yes.
need to get better. We all need to eat better and be healthier. So really just taking the patient out of it and just making it more about the family, I think
Hmm.
is helpful.
I always tell patients and community members too that, you know, even when it comes to moving your body and find joyful movement and involve your
Yeah.
family. It's a win-win. Your children are happy that you're playing with them
Yeah.
and dancing and you're moving your body. So it's always an
Yeah.
opportunity to involve the family.
Just I say it over and over like all day. Just go outside.
Hmm.
Just go outside. Try to get a walk in, 2 walks in. Even
Yeah.
if it's a 10-minute walk, it doesn't matter. Steps matter.
Steps do matter.
When you park far away.
Hmm.
When just any added steps that you can factor into your day are very helpful. And then
Hmm.
making it about the family. Like after dinner, let's all go on a 20-minute
Right.
walk.
Yeah.
Um, People do live in areas where it's really hard for them to walk from their house, so it
Right.
makes it difficult, like lack of sidewalks or lack
Hmm.
of with cars and all that. So
Exactly. Yeah.
sometimes it's easier for people to do that than others, but
Hmm.
it is really helpful to move after a meal, especially after dinner.
Hmm. Find some movement. Okay. My last question too is that, you know, a lot of patients struggle to advocate for themselves.
Hmm.
We see that. What practical tips can you share for people with diabetes to just become better self-advocates?
I think it's about owning it. We've
Hmm.
touched on that a couple times
Yeah.
already. And I mentioned how I like to tell my patients, like, we're here. This
Hmm.
is not the result that you're hoping for. This is not the result that I wanted for you.
Yeah.
But how we got here at this point doesn't
Doesn't
matter.
matter.
So what you do from here on out is really what matters, because you got the diagnosis. So what do we do now? You have options. You can keep doing the same thing, but
Hmm.
we know you're only going to get worse because diabetes is a progressive disease.
Exactly.
So you can continue to do the same things. That is an option, but that's not going to end well for you. So it's more about owning it and then starting to make a plan to change, because you really have to change. Now, people don't like to change,
Yeah.
whether it's at work or in their
Hmm.
daily life or anything
Yeah.
else. We crave the same thing. So
Yeah.
it's really hard to change.
And like you say, making a change, but knowing that it could be just small changes really can make a
Yes.
difference. Everything doesn't have to be so drastic. So,
And so quick.
and so quick. Yeah.
Like, I try to tell people with diabetes and with weight control, like, you didn't get here in a day or a month
Hmm.
or a year.
Hmm.
You've kind of been building up
Okay.
to that all your life. It could be
Exactly.
20 years, 30 years. So don't expect that we're going to just fix everything in 3 months, because
Right.
you're going to be disappointed.
Yeah.
So it's going to take time to get you back to normal, get you back to healthy.
Hmm.
So having that expectation up front, I think, is helpful, because sometimes people come back 3 months or 6 months later and things haven't moved too much, and then they can be disappointed and then slack off, and then they're like,
Hmm.
well, this is not working
Right.
anyways. So just setting those expectations early, that it's gonna like take time to get us out of this, and it's gonna take a lot of work. It's not gonna be easy.
Hmm.
So really, it's just about doing small incremental changes, like every day or every
Hmm.
week, like focusing on certain things and trying to get better at them, and then over time,
Hmm.
that will get better.
And it will become your lifestyle.
Yeah, exactly. Like not making slow, like not making quick drastic changes, because
Hmm.
those don't
They
last,
don't.
but making like slow and meaningful changes that you can really keep up with, and knowing that we're all human. Like you're still going to have days when you're
Yeah.
not going to behave. Like you're going to want to go and eat a cheeseburger with soda, and just know that if you do that, just don't let it carry over to the next day.
Right.
Like we're all allowed to have an off day.
Exactly.
And don't feel shame about doing that. That's fine. But just you can't do that every day.
Yeah.
Yeah. So that's really it. Honestly, it's more about just owning what you have and then making changes over time to improve your lifestyle.
Well, thank you. I appreciate that. The real response.
Yeah.
Yes. Well, I definitely want to thank you for your time today.
You're welcome.
I definitely enjoyed this conversation. Like I say, diabetes management is something that is kind of near and dear to me, and being involved in this work. So for our listeners out there too, if you are looking for a healthcare home, Advanced Community Health welcomes you with open arms. We have an amazing team of board-certified healthcare professionals, as you can see, ready to serve you. For more information and to schedule an appointment, give us a call at 919-833-3111. As a reminder, you can catch us every third Thursday for a new episode of It's Giving Health. You can find us on Apple Podcasts, Spotify, YouTube, or Podbean. Subscribe to Advanced Community Health at Advanced CHC to stay up to date on the latest episodes. I am your host, Donnae Ward.
I'm Ziad El Tannir.
And it's Giving Health.